Hi guys, this is Charles. I'm one of the surgeons at the Animal Emergency Center in Moorabbin. Today we've got an interesting case, which is a little mixed breed dog that has a history of, by the way, hypercalcemia. And so they did a parathyroid elevated. So elevated parathyroid hormone in the face of tumor. And so an ultrasound was done, and that showed what they thought was about a parathyroid mass on the right parathyroid gland. And so we are doing a cervical exploratory to try to find this parathyroid mass, and they can be quite tricky to find. If we can't find it, can I get some more mets, please? If we can't find it, what we'll do is we'll remove 3. Can I please get... If you haven't already done so, please subscribe to our channel. Make sure you turn on notifications so you'll get a ding on your phone next time we live stream. So I'm just cutting through this fascia. And I'm going to split the sternothyroides muscles. It's nice to try to find that kind of push to one side in this dog, I think. So we can see the larynx up here. So, nerve there. That's the thyroid gland right in there. Nerve is right
yes.
there. In the carotid sheath is going to be over here laterally. Here's the other thyroid. I'm just going to enhance my exposure a little bit. Again, being really careful not to damage the recurrent laryngeal nerve. So there's thyroid right there. I can see what looks like parathyroid sitting right there. Cross deep to that. And again, these can be kind of tricky to find. These adenomas. And that's the mass right up here. So I can see that clearly. You guys will not be able to see it yet, but I will try to measure so you can see it. And I'm shaking. So I've had cold symptoms for about 12 days. A bleeder from the cranial thyroid. All right, so that's the mass. I don't know if you guys can see that. Is that apparent on the video? Right there, that's the mass. What I might try to do is zoom in. See if I can zoom. Do you know where the hook cautery tips are by any chance?
No, but I can ask.
Okay.
Do you need a hook one? Do you need anything for the blood pressure? I'm gonna keep an eye on that. It's difficult, but I'm gonna check the camera for
The risk with these is that after you take out the parathyroid tumor, that they can I get a 11 blade, please? There in my hand. You can just barely see it. It's tiny. The wattage I've got on the electric cautery right now is set on 30 and 30 a bit high. Can we get a hemostat, please? That doesn't matter. So as I retract, the tumor is becoming even more apparent. Yeah? Just bluntly dissecting that off the thyroid. All good? D, we're good?
we should be okay.
So that's the mass. Pretty much it. So we'll just make sure that we don't formalin. And just check. All right, so that is pretty much it. I might just quickly have a look at the other gland just to make sure there's no obvious other mass, although affected. I can see one parathyroid right there. You guys won't be able to see that because it's very subtle. Just right there. Recurrent laryngeal nerve. And of the thyroid. So can I get some 3O PDS, please? So this dog we did very low dose acepromazine and then methadone, and then alfaxin reduction. Sorry, can I get 3O on a taper needle? Thank you. This dog has a whopping heart murmur. Did an echo on it before we induced anesthesia. Probably should get some saline. And just some saline, please. thank you.
There's a question on anatomy of the glands in relation to the parathyroid.
I cannot see the question completely. I'm finished and I'll go back and read it. And I very possibly won't know the answer. All right, so then I'm just going to reoppose my sternothyroideus. I'm putting together an e-learning module today. Actually, I'm not sure when I'll get it out, on electric cautery and settings and pitfalls and things like that. I'll have a link to it on my, probably on my Ko-Fi or Coffee. I'll put a link to my Coffee page in the description, but again, I'm not sure when I'll have the e-learning module completed. But that's one of the most common questions I get from people, is what settings I have my cautery on and specific techniques and stuff like that. The problem that I might encounter trying to get the e-learning module released is that I'm trying to find video from all my YouTube videos that demonstrate the different techniques. So that's going to take me a while, so I'm not sure if I'll get that done before I go on holiday. Can we get that in formalin? Is it already in?
Yeah, it's already in the formalin.
Great, thank you. That just being how small that is, it'll dry out pretty quickly. Bury my knot here and getting this platysma / cutaneous trunci muscle opposed. and then you can use that 3.0 on it, Cindy, to close the intradermal layer if you're happy to do that. All right, so that's it for me. I'm just going to go and make sure I haven't missed any questions on the live stream. No, so we don't have to have the calcium normalized in these cases prior to surgery. So post-operatively, we're going to monitor calcium every day for about 5 days. It's going to be in-house for one night, and then it's going to either come here or go back to its referring vet. There's a question about alfaxanone not being registered in Nepal. So other drugs that you could use, propofol works really well. That's probably the one I would recommend. If you can't use that, like something like ketamine. On this dog, we did parathyroid hormone levels, ionized calcium levels, and then we also did a where the mass was identified. So on this dog, it was just elevated calcium. Hi, Mexico City. Eli to an inferior. I'm not sure. I don't know the anatomy to that level of detail. So regarding the laryngeal nerve in the inferior ventral, I don't know the answer to that. So my cautery is set on 25 watts. Hi Mexico, hi Philippines, hi LSU, hi Nepal. So with that, we'll go ahead and finish up. If you haven't already done so, turn on notifications so you'll get a ding on your phone the next time we live stream, and we will see you again. Probably not very soon because I'm going on holiday for a while, but I'll be back early mid-July.